Hello. In this video, we're going to look at using our textbooks in conjunction with virtual radiography. So we're looking at a textbook page here. This is Bontrager and Lampignano. We're just going to x-ray some toes. And then we're going to also look at some notes that I've taken from the textbook, where I've put some of the information in the textbook into a slightly different order. So here, for example, we've got the 3 Ps: position, posture, and projection, and that covering the notes that we want to make to try and remind ourselves how to do this examination. And then we've got the rest of the information here under collimation, some technical factors, and some more notes. So this is pretty much the vital information that we're going to use to guide us when we're creating our exposure. I'm in the console here, and I'm going to go to the Study tab, Modality Work List, and I'm going to go down here to the Foot Plantar Flexion Phantom, and I'm going to make that selection. And then I'm going to go to the foot and ankle anatomic gross region. The study is going to be toes, left, and I'm going to do a dorsiplantar toes. Okay, so now we're going to go to the exposure tab. I'm going to drop this down to 50 and 0.5. And I'm ready to expose. So now I'm going to go to my X-ray room, and I'm going to bring the patient into the room. Well, obviously we'd follow our normal procedure, which is to bring the receptor into the room. Now I happen to know that the toes are going to be at this end, so the yellow edge, I need to put that. I'm trying to remember what I've written on my form. I'm going to raise because my patient's not going to walk into the room. Well, we'll leave it low, as if the patient was going to walk into the room. So I've moved my receptor over here, and I've put the orientation correct. I've got the X-ray tube correct. I'm going to bring my patient in now. So here's my foot. Now, when you move the foot, you'll notice that as I walk over the foot like this, if I move my hand over, the hand goes green when you get near the middle and then disappears again. So we're going to hover over where the foot is green, and you see the arrows, up and down arrows. This indicates to me if I click here and grab hold of it and keep clicking and then move it up, then I can move it away from the receptor, which is always a good thing. And now what I can do is I can fiddle with it. What I'm going to do to start with, though, because I might forget, is I'm going to raise the table up to working height, so the source image distance is 100 centimeters. Okay, so now I've got that correct. What I'm going to do is I'm going to bring the toes down, and then I'm going to turn around, and I'm going to bring the foot out, and I'm going to move the foot down to the receptor. Now I have to look in all different angles, because it can be deceiving if you don't look in all different angles. So you see how my foot is quite splayed over. And this is quite common for people to do this, to splay their foot over. In fact, you might want them to do that. It might help. I'm just going to twist the foot using the scroll wheel until it's more flat on the surface. Now you notice how the toes are raised up. So the toes are sort of extended. We haven't got the problem that they had in the book. It's almost as if we've got a foam wedge here. So I'm not going to use the angle. I'm going to use a straight tube, because effectively the toes are extended, and so there's no problem with getting through these joint spaces, I don't think. We could do both to see what would happen if we did a 10-degree angle towards the calcaneum in this circumstance. Okay, so what we're doing now is we're centering. So I'm going to suggest that we count. This is the first toe, the great toe, and then this is the index toe, and then this is the ring toe. Sorry, this is the middle toe, this is the ring toe, and this is the little toe. So they have names as well as numbers because the A&E doctors like to name fingers and toes rather than number them, just in case the numbers have gone the wrong way round. So this is the first, second, third, fourth, fifth. So what we're going to do is we're going to center on the third toe. So what we want to do is center on the metatarsophalangeal joint, and then we want to use the collimation to collimate to include the adjacent toes and the distal metatarsals. So I'm happy with that. Now I'm going to try and put a marker on, and we want to put the marker on the lateral aspect, which is over here. And as you can see, it's going to be tricky to get this marker on while keeping the collimation small. We've just about managed it though, so that's fine. We don't really want it over the don't want it to actually go over the bones, so more soft tissue really. So that's fine. So now just have one last look just to make sure everything's okay. So this is a straight tube, no angulation, and what we'll do is we'll go over here and we'll hover over the exposure button, and we'll wait till it goes green, and we'll expose. So we've got our left marker, we've got the three toes, the adjacent toes and the metatarsals, so that's all very good. We're actually not through this joint space though as well as we might be, and we've also got an exposure index of 65, which is a bit low, so my setting of 0.5 is probably a little bit too low, so we need to double that and then double it again to get to 250. So if we go to 2, 50 and 2, that should give us what we want. Also, what I'm going to do is I'm going to try the angle. So we're going to angle the tube 10 degrees towards the heel. So I'm reading that off at the bottom there. So it says 10 degrees on the bottom there. And then what we'll do is move this along until we center at the right place again. Zoom right in so I can see what I'm doing. So I'm happy with that. And then we'll expose that and see whether that's better. Okay, so our exposure index is better. We're at 354 now, which is a little bit higher than we wanted to be, but it's better to be slightly higher than slightly lower, really, because this is an image quality problem. We can talk about that, but whereas it is slightly better. We are through the joint spaces a little bit more there than we were here. But both of these are pretty reasonable. And what we can do is we can just try the 15 degrees and see whether that makes it worse or whether we've gone past the optimum. So scroll and go to 15 degrees, which was the other alternative, and get to 100 centimeters and bring this across to center in the right location again. And so I'll drop that to 1.6 to see bring close up exposure there, and if I bring that to comparison So we've got this doubling up, which gives us these little white lines, and now we're not doubled up. We're through these joint spaces a little bit better. But now we're starting to lose the metatarsophalangeal joint space. So it's a bit of a tricky one, isn't it? Where we had metatarsophalangeal joint spaces, we don't have them anymore. We've got through this joint space where we didn't have the distal interphalangeal joint showing